Yeah, I'll be sharing it, and then I will pass it on to you, Morningstar, and then you can share your screen.
Okay.
Hello, everyone. I think we can give a few more minutes for everyone to join in, and then we can start. Hello, everyone. I welcome you all to our today's webinar, Fears of Breast Cancer Screening. I'm thoroughly honored to present, to facilitate this webinar. I welcome you all. I'm glad you all can be a part of this important webinar. Just providing you all with a few housekeeping items. This presentation will be recorded and uploaded to AICAF's YouTube channel. Since we would like to know more about you, please share your tribal affiliation and land acknowledgement. A quick reminder to make sure that your microphone is on mute throughout this webinar. If you have any questions, please feel free to ask in the chat box, and we will try to answer them all at the end of the presentation. Also, a reminder that live captioning is available throughout the webinar. If you have any questions in the future, feel free to connect to AICAF at the given email information. Trying to provide a few information about AICAF. AICAF is a national nonprofit organization established to address tremendous cancer inequities faced by American Indian and Alaska Natives. Our mission is to eliminate cancer burden on American Indian families through education and improved access to prevention, early detection, treatment, and survivor support. Our vision is a world where cancer is no longer a leading cause of death for American Indian and Alaska Natives. Through hard work, culturally appropriate community-based programs and policy change that affords Native people access to the best prevention and treatment strategies, we see a day where American Indian communities are free from the burdens of cancer. Now I'm honored to introduce our esteemed guest for today, Morningstar Spencer. She has worked at the Urban Intertribal Center of Texas for the past 6 years and partnered with them for 11 years in breast cancer awareness events. Morningstar is also a 12-year stage 4 inflammatory breast cancer survivor. She was a healthy, active wife and mother of 2 with no family history of breast cancer when diagnosed at the age of 29. After chemotherapy, a modified radical mastectomy, and 31 rounds of radiation, she was considered NED, meaning no evidence of disease. Now I pass it on to Morningstar to share her experiences and onboard us on her journey and try to share more information on today's topic. Passing it on to you, Morningstar. Morningstar, you're muted right now.
Is there a way for me to share my screen?
Can you see a green icon which says share screen at the bottom of your screen?
Sorry. No, still not. It's not sharing the right one. Are you able to see it?
Yes, we can. So just requesting you to maximize your presentation so we can see it more big.
You are able to see it.
Yes, we can see it, but just can you maximize your screen? Yeah.
Okay.
Yes.
All right. So our topic was facing your fears. And what does this mean and why is it so important? With mammograms, I know that they request that you do them yearly after age 40. And getting them can be uncomfortable or cause anxiety or may even make you feel shy or to be exposed to a stranger. There's many things that I hear of, lots of reasons why women do not want to go through with them or feel they're not that important. But these feelings, I wanted to realize that they are just temporary, and once you overcome that one day that you're able to go and complete your mammogram, then you can leave and feel good that you are being proactive in your own health. I know that leading up to it, there's always some kind of discomfort or something that somebody says that happens every time. I haven't experienced too much discomfort, and I've gone every year since I was 29 now for my yearly mammogram. So it is something that it's just like any other, our physicals or shots that we have to get, just to be proactive in our health. And like I said, it's just a temporary thing that we have to do every year. And did you know that having a mammogram done can detect changes in your breast you otherwise may not notice? Because the truth in this is 1 in 8 will get a breast cancer diagnosis in their lifetime. And early is the key word in all of this. The early detection can mean the difference between a very small procedure to have done to treatment. And that could be chemo or radiation or more extensive surgery. So detecting those changes as early as possible is such a game changer in everything. Um, Also, knowing your body and when to take action can also help detect any abnormalities early. We want the earliest, if it is a diagnosis, we want the earliest stage that we can get as possible. Um, that's key when it comes to our health, and adding the knowledge actually increases our effectiveness in recognizing any of those changes that our bodies could be going through. Some of the cultural barriers that I see, there is a lot of distrust still just in Western medicine and even from outside facilities. I know we have a lot of patients that come just strictly to Indian healthcare facilities for all of their healthcare. Um, and here at the Urban Intertribal Center, we understand our history and why it can play a role in some of the reasons patients may feel this distrust. So it's even in some of our cultural training for our non-native employees, so that they are aware of that for anyone that is coming in, and that they know their patients and know that they may have to gain trust with them for them to open up and feel comfortable with them. And we hear from patients all the time that they come to us because they feel comfortable being around other natives. And that, you know, that even for me working here was a huge comfort in otherwise where I'm somewhere where I don't necessarily feel like I fit in, or I'm understood in other places. So I can understand why patients would come to us for all of their health care. Another barrier I see, which it's not specifically cultural, but just on a wide scale of low income people that come to us that have no insurance. And for this, I know many believe that Indian Health Service will cover everything. And unfortunately, that's not the case for us as Texas residents. But now that we're partnered with American Indian Cancer Foundation, we're able to offer services here locally to those who qualify under their grant as well. And if not, there's other avenues that we take as well that to make sure we get the patients to the care that they need. I was in the same boat when I was diagnosed. I did not have insurance at that time. I knew that Urban Intertribal Center was here, but I knew that they didn't have a mammogram machine here. So I didn't think that I would even had been able to come here for any type of diagnosis, which that's not the case. I could have came here and probably saved some time while I was still trying to figure out what exactly was going on with myself and my body, and could have probably bypassed a lot of that time that was spent trying to get into somewhere else. So it is important for them to know that, yes, please come if you feel that something is wrong. Even though we don't have a mammogram machine, we may be able to get you in somewhere here locally, or even at an Indian healthcare facility that can get you in as soon as possible. So we are able to get some answers for you. And good medicine, the best medicine to combat fear is your attitude. Just having a positive mindset, and in anything, any type of fear that you're feeling. And it doesn't have to just come from you, because I know sometimes that's easy to tell somebody, oh, well, you know, just have a positive attitude when you go in, but that's not always possible all the time. So having a good supportive friend to go with you, maybe for a mammogram, even if they're just sitting in the waiting room with you, or that drive that you have to make going up there to the mammogram facility, is always so helpful. The support groups, they are awesome. I've used several different ones, and therefore absolutely everyone, whether it's somebody that maybe notices breast changes and they're wanting to talk to others in a group and just kind of get some feedback from some other members that were going through the same thing. They even have support groups for spouses or family members of those that are going through either a diagnosis or treatment. Even aftercare, there's absolutely support groups for every person that would be involved. Even if you get a diagnosis of breast cancer, a positive outlook can be the healing environment that you need to overcome that fear. Fear is so natural, and it's not wrong to express that. But once you do process and understand where you're at and what needs to be done and the plan that's set before you, that's going to determine the type of travel that you have while you're walking this path. So there's so much support that's right at your fingertips. I mean, there's things on through Facebook and Twitter and even through the center, there's different things that we can reach out to that are here locally for in-person support groups as well. They're such a good outsource for anyone, even if it's not to do with just breast cancer, but any cancer diagnosis. They're extremely helpful. What you need to know and how to be proactive. So getting those regular mammograms and clinical breast exams, that's how you're going to realize any changes. The regular mammograms, even if you don't go to the same facility, they're wanting to still see the CDs from other ones so that they can compare those and notice, and even if it's a minimal change that they may want to keep an eye on, they may tell you come back in 6 months instead of waiting a year. So it's very important to keep those yearly mammograms and clinical breast exams as well. Knowing your family history. In my case, there was no family history, but now that I know that the type of breast cancer I have, it's important to let the rest of our family know, our children, and anyone else that's coming after us, so that they have that information and know if they need to be screened earlier or know the symptoms that we started having, so that they are proactive in their own health. Breast changes. This was the biggest step in me getting my diagnosis and realizing that something was changing that was not normal. So swelling, redness, dimpling, inverted nipple, lump, or any type of pain that could be in one or both breasts. It's important to realize those changes. Eating healthy and exercising play an important role as well. Limiting alcohol. And your health is not just about you. It is about everyone who loves you and cares about you. I think I had to realize that I knew what my diagnosis was, and as devastating as it was at that time, I knew what I needed to do because there was people that depended on me, there was people that loved me, and just getting to that point, even with the mammogram, that's what you also need to remember, that mammogram isn't just for you, that's for the family that loves you and cares about you, so that you are healthy. And that early diagnosis, like I said, that is the key to everything. Also important to know you're not alone. There's, like I said, there's all the support groups, but even here at the center, if we do know that there is somebody that is diagnosed, and they'll try to usually come get me so I can go and talk to the patients in the room or reach out to them later. And I like doing that because I want them to know that there is hope, because that's the most important thing in all of this is there is always hope in every situation. My diagnosis was not very good at the beginning, and um, even my survival rate was not very good when they first gave that to me. But, you know, I had to hold on to the hope that things may get better, that the treatment may work in a different way for me. And it did. And so I do like to be able to talk to our newly diagnosed patients here, just so that they know that, you know, that there's hope, that even if doctors are telling you one thing, that there is still hope that things could change and get better. And then I was going to end with this quote that I really liked, by Eleanor Roosevelt. You can gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. The danger lies in refusing to face the fear. In not daring to come to grips with it, you must do something you think you cannot do. And that pretty much sums up my whole cancer journey. And it continues even now. I mean, with I still have fears that, you know, of reoccurrence, and having to go back to the same facilities for my mammogram can cause some fear, but getting it done and getting a final conclusion to that fear, and just having a plan of attack every time is what helps me feel accomplished, feel like I did my part, and then have that peace ultimately that, okay, I know now where I'm at in this.
Thank you, Morningstar, for sharing this vital information and making us a part of your journey and sharing your experiences. I would like to uh, let everyone know that we are open to any questions that they might have, and they can put them in the chat box. And meanwhile, Morningstar, I do have a question for you. Is that according to my experiences and working with the community, I do know that some women feel that they might experience pain and unpleasant experience while getting mammograms done. So can you shed some light on the screening procedure aspects of mammograms, and if you could let us know a bit more of the technical aspect of screening?
Uh, it's pretty. I mean, it's not uncomfortable. Every place that I've been to, they're very accommodating, and they usually take you in the room, so you're not there's not a lot of people that are around while you're. It's usually a changing room that you go into for the same area that you're going to have the mammogram. So it's just you and the technician. And I've never been where it actually hurts, but of course there is a little discomfort in the mammogram for them to get an accurate visual of everything. And usually right then, after they take all of the imaging that they need, then they'll go and have the technician take a look at everything just to make sure everything is clear before you leave. But it's probably less than, I'd say, 5 minutes that you're in there with the actual mammogram machine. It's not very long at all.
True, right. And we have one more question, and that is what one way that the healthcare providers can support women to complete their mammogram screening. So any of your experiences from the clinic wherein the healthcare providers have supported the women in completing the screenings, navigated them, any such experiences that you would
I mean, just encouraging and just letting them know how important it is. I know even just with follow-up calls, sometimes if we notice that a patient hasn't gone and we've already sent orders for her mammogram, then sometimes we'll have our navigators call out to them and see, exactly why they haven't gone yet, or if they've had issues with a ride, or if it's really just fear of going, or sometimes it's time or them just not thinking it's that important to do right then.
Right. Right. And I think sometimes even women feel that they're completely healthy and it's unnecessary for them to go for that mammogram screening, getting that done, because they feel they're quite healthy, there's nothing wrong with them. So just trying to understand how can one motivate themselves to get that regular screenings done. And yeah, if you could let us know a bit about that.
Well, even with myself, when I was diagnosed, I was very healthy. I ran, I took care of myself. I was not a smoker or drinker at that time, and there was just no family history. So it was completely unexpected. And I am glad that I went and reached out when I did. And notice the breast changes. And so even then, it was so minimal at the beginning, but even then I probably would have waited a few more months and not been proactive in any of, trying to reach out to somebody for that diagnosis. So yeah, I would say even because that was at age 29, which I know that it's not recommended until 40. So that's why it is so important, even at a young age, not to just dismiss any of those breast changes.
Right, right. And one of the takeaways for me from this conversation is to have a positive attitude, to cope up with the fears and anxiety and the current situation. So I would just like to know what's one thing you'd like people to take away from today's conversation. Any high points or highlights that you want to just let people know from our today's conversation or from the webinar itself?
Just that there is always hope in every situation, whether it's a small diagnosis that, stage 0 to stage 4, that there's hope in every situation, and that we are here. Even, I mean, I'm always available to take our patients' calls if they need just someone to reach out to that's been through the same thing as well, or just that encouragement, even if it is just for the simple screening mammogram that they need to go to. But that's probably the most important, that that positive attitude really can be just that mindset that you need to be able to follow through.
Yeah, and I do know that being a cancer survivor yourself, you just mentioned that's important to, have that positive attitude towards the road of recovery, have that sense of wellness and well-being throughout. So just trying to know if there are any takeaways in that manner, and if you could share how you took one day at a time and, try to.
Yes, definitely during treatment, because chemo was not the most pleasant experience throughout the whole process. But, on my very worst days that I felt horrible, I knew that the next day I was going to feel better. And so every day I would tell myself, okay, I feel really bad today, but tomorrow I know I'm going to feel better than I do today. So it was just kind of pumping myself up every day, like that little engine that could just, it's just a little bit at a time, and that you're going to get over feeling that way, and it's just temporary. So I mean, that's how I had to do a lot of myself through treatment, just talking to myself.
True, true. Yeah, those were the questions we had. Thank you, Morningstar, for being a part of this webinar and providing this important information through us. And I would also like to thank everyone for being a part of this webinar.
Yes, thank you very much.
Thank you. Thank you all.